Despite communist regimes of the world having sent between 60 and 100 million people to an early grave, I'm talking the likes of Stalin and Mao, the World Health Organization's newest hire has no qualms about her commie ideology. After 2 years terrorising the scared, witless British public with COVID propaganda, Professor Susan Michie recently joined the World Health Organization as its Behavioural Insights Chief. Behavioural insight is the fancy term for nudge theory, the way governments influence the behaviour of its citizens. Do you remember this classic piece of nudge propaganda during the height of the pandemic? That came courtesy of Michie and her fellow COVID nudge unit zealots on SAGE, the UK government's hysterical advisory group on public health. And imagine that. A virus so lethal to all of mankind that governments need to hire propaganda units so us thick mere mortals toe the line. Well, despite pretty much all sane corners of Britain moving on from COVID, laughing Michie couldn't contain her excitement earlier this year when insisting we should wear bacteria-ridden face masks and social distance forever.
And the third thing is people's behaviour. That is the behaviour of social distancing, of when you're indoors, making sure there's good ventilation, or if there's not, wearing face masks, and hand and surface hygiene. We'll need to keep these going in the long term, and that will be good not only for COVID, but also to reduce other.
So when you say long term, sorry to interrupt, Professor Michie. When you say long term, what do you mean by that? How long? Very quickly.
I think forever.
Truly terrifying, chilling. Last year, Michie, who has been affectionately nicknamed Stalin's nanny, was quizzed by the Unheard website about her Communist Party membership of 40 years. She said it wasn't a problem for her public health work and even had the gall to say that questioning her political affiliations had, quote, no place in a tolerant society. Look.
My politics are not anything to do with my scientific advice. And I've never discussed my politics with people like yourselves. So nor am I going to now. Kind of articles you referred to are a really disturbing kind of McCarthyite witch hunting, which I don't think should have any place in a liberal, tolerant society.
I'll tell you what has no place in a tolerant society, Michie. 2 years of fear, propaganda and downright brainwashing of a nation that was led to believe a virus with the same mortality rate of seasonal flu was worth destroying the entire country for. Susan Michie was ringleader of that psychological torture. Karol Sikora, Michie is now peddling her work for the World Health Organization just as it's ramping up monkeypox hysteria across the globe, declaring it a public health emergency. Now, you were once the cancer chief at the World Health Organization. This was an organization you really believed in. So what on earth has happened, Karol, for them to have now hired communist Michie, such a terrifying individual, to head its own nudge unit?
This is all bonkers, Dan. I mean, It really is. This lady is going off-piste, even within the WHO. She chairs a committee in the WHO. She doesn't actually work for them. She's a professor at University College. She's not a doctor. She's certainly not an infectious disease specialist. She's a behavioral psychologist. These people change people's behavior. And that was what was tried to be done during the COVID pandemic. To her to come out with a statement to say, from now on, forever, masks and social distancing have got to be there, is just complete nuts. It's like me saying something about it too. I know that if you do that, people will die from other things, such as my specialty, cancer. This is just madness. And I think there are lots of people out there. 2 weeks ago, we had a discussion on this very programme about the editor of the British Medical Journal and the Health Journal saying the same sort of stuff. It's a disaster. The NHS is going to collapse because of COVID unless we all mask up and do this and that. This is nonsense. It's people looking for PR, basically, publicity. And it's just very sad to see.
Indeed, but should we be concerned, Karol, though, because she actually had huge success during the pandemic in terms of terrifying Brits. I mean, you know how terrified people were, so terrified that they didn't even go to hospital when they had obvious signs of cancer. And we're seeing the trauma now in terms of the massive cancer backlog. And you spoke about it at the time. So should we not be scared? Because the World Health Organization is an organization that has huge power and huge backing from, you know, China, not to mention many of the world's top democracies.
Absolutely. But I think we would find the WHO just doesn't even know she's spoken like this. I think that's the problem. She's not representing the WHO in this. She's representing her own beliefs. And that's very dangerous. And lots of people are doing that about COVID. So actually getting a collated view of what we should be doing about it is just not there. It's like a rogue, someone going rogue on the whole thing. And we have to be very careful because you get attention if you do it, as she got, and as the BMJ editor got. But, you know, the NHS hasn't collapsed over the last 2 weeks. We're not infiltrated by COVID. I looked only at 4 o'clock today at the last 24 hours data. It's never been better in the UK. We're doing well. And COVID is not part of the problem. The problem, of course, Dan, as you well know, is the NHS is collapsing for totally different reasons.